Chapter 15, Trace Minerals, Screencast 4. The first trace mineral that we'll be addressing in this screencast is going to be selenium. Here, once again, we see that the best source of selenium is proteins, and the proteins listed here are primarily animal-based proteins. Most selenium in foods is actually bound to methionine and cysteine, and remember they are amino acids. Absorption of selenium is not impacted by body stores of selenium, and balance is actually achieved through urinary excretion. As it travels, it is bound to transport proteins in our blood. High concentrations of selenium can be found in the pancreas, liver, kidneys, muscle, and thyroid. Selenomethionine provides a storage pool, and selenocysteine is the biologically active form of selenium. It functions as a component of several enzymes and proteins. Here we see glutathione peroxidase enzymes. So remember that is going to help prevent lipid peroxidation and damage to cells from radicals. It destroys specifically peroxyl free radicals and will actually spare vitamin E. Thyrodoxin reductase enzymes, selenoprotein P, iodothyronine deiodinase enzymes, and that plays a role in converting T4 to T3. It may actually help prevent a disease known as Keyshawn disease and decrease the risk of both prostate and lung cancers. Here, this is something that we have seen previously. It is the glutathione peroxidase system. The first step is glutathione peroxidase, and we see basically with impact-free radicals that can potentially damage to the cell membranes or structures. Here we see where vitamin E actually plays the role in stabilizing these free radicals overall, preventing this type of damage. Now, the deficiency of selenium is associated with thyroid hormone metabolism, risk of certain cancers, and Keyshawn disease, and that is characterized by insufficient cardiac function. Symptoms of toxicity include nausea, diarrhea, fatigue, hair loss, changes in nails, and impairment of sulfur and protein metabolism. The upper level for selenium is 400 micrograms per day. Chromium is the next trace mineral that we will be addressing in this screencast. And basically, chromium is widely distributed in a large variety of foods. Small amounts can actually be transferred to food through processing. When we look at the dietary needs, we actually have adequate intakes, and it is going to be dependent upon the age. We're looking at 35 micrograms per day for men 19 to 50 years, 25 micrograms per day for women under the same age group, 30 micrograms per day for men over 50, and 20 micrograms per day for women over 50 years. The daily value for chromium is 35 micrograms. Little is known about how chromium is actually absorbed. It is transported by the protein transferrin. You can find it accumulated in bone, liver, kidneys, and the spleen. And the way in which chromium is excreted is via urine. The functions of chromium include enhancing the action of insulin, promoting the uptake of glucose, and also the normalization of blood glucose levels. The symptoms of deficiency include, unsurprisingly, glucose intolerance, nerve damage, and weight loss. The upper level for chromium is not set. There are athletes that actually use chromium picolinate to enhance muscle mass and strength, and these individuals should actually be monitored for possible toxicities. The last trace mineral that we will be addressing is fluoride, and this may not be considered an essential nutrient because our basic body functions can take place without fluoride. In foods, the major source in North America is fluorinated water. It can also be found in tea, seafood, and seaweed. Now, non-dietary sources include toothpaste and mouth rinses that have fluoride added to them. And keep in mind, most bottled waters do not contain fluoride. The adequate intake for fluoride is 3 milligrams per day for adult women, 4 milligrams per day for adult men. And this is something new that we haven't seen before, looking at the adequate age for infants and young children. So if we talk for infants up to 6 months of age, the adequate intake is 0.01 milligrams per day. For infants from 6 months to 12 months, it goes up to 0.5 milligrams per day. And when we talk about young children and adolescents, the range goes up to 0.7 to 3 milligrams per day. The adequate intake is based on the amount of fluoride needed to provide resistance to dental caries without a mottling of the teeth. 80 to 90% of all fluoride is absorbed rapidly, and this is strictly through passive diffusion. Unsurprisingly, it is concentrated in teeth and skeleton. The greatest amount of fluoride is actually deposited during infancy, childhood, and adolescence. Calcified tissue deposition and urinary excretion are the main ways in which we actually get rid of fluoride. If we look at the functions of fluoride, probably the one that we are most familiar with is to protect against dental caries. It also will support deposition of calcium and phosphorus in both teeth and bones. Deficiencies associated with increased dental caries. Toxicity may be reported in young children, and this is due to swallowing fluoride tablets or solutions. It is important to keep in mind that acute toxicity of fluoride is life-threatening. Signs of toxicity include nausea, vomiting, diarrhea, sweating, spasms, convulsions, and coma. The chronic intake of excessive fluoride will actually result in mottling of the teeth. The upper level is 0.1 milligrams per kilogram of body weight per day for infants and children up to 8 years, and 10 milligrams per day for 8 years. Now, the next two slides are demonstrating the table associated with key trace minerals, and keep in mind this will address the major function, deficiency symptoms, individuals at risk, the RDA or adequate intake for adults, good dietary sources, and toxicity symptoms. Now, there are also some minerals that are considered to be ultra trace, and if we look at what they are, I'm just going to list them. I'm not actually going to go into their proposed function, but something to potentially be aware of. They would be arsenic, boron, nickel, silicon, and vanadium.